The public health recommendations of this pandemic come from Saskatchewan's Chief Medical Health Officer. And for a look back at the year that's been, Dr. Saqib Shahab joins me now. Thanks for being here.
Hi, Sam. Pleasure to be here.
It's been a while since we've talked, so we have a lot to catch up on. But first, let's talk about yesterday's announcement about expanding eligibility for booster shots. Given that push, how concerned should we be about Omicron?
So first of all, I think, again, we should all think how lucky we are to be in Saskatchewan and in Canada to be able to actually offer boosters now with a 3-month interval. So, we need to take advantage of this opportunity and get boosted as quickly as we can. And we already have, long-term care residents are boosted in September, 65 plus for a few weeks, and then 50 and over. So I think we're moving very quickly, and it's really important for people to get boosted, A. And second, for those still not vaccinated, get vaccinated. And for children 5 to 11, please get your children vaccinated. This has been a long pandemic, and most pandemics is a single strain like the H1N1 or the 1918 influenza. It's one strain. You have 2 or 3 waves, and you've done 18 months. I think none of us expected that you'll have new strains coming out. In Regina in March, we were surprised with the Alpha strain that started in the first identified in the UK. And then in the fall, we had our 4th wave with the Delta strain. And now, just on the heels of the Delta, we just came out of that wave. We were doing really well. And now this concern with Omicron. And, we just need to then adjust, course correct, and get ready for that. And again, the fact that we have the ability to, first of all, the vaccine and the ability to give boosters in a timely way is critical and really important.
We are 1 week from Christmas. What should people know when it comes to gathering or traveling to see family and friends?
So, last year, of course, it was very different. We couldn't really meet much except outdoors. This year, we're very blessed. Our case numbers are low. And there's 2 critical things that are important this year. One, of course, many of us are fully vaccinated. Many of us will get a booster dose. That's going to be important. Second is, we have one of the provinces with abundant home testing supplies. And I would really recommend everyone, every time you go into a gathering, everyone should test themselves. If you're asymptomatic, you're test negative, that's a great reason to feel, doubly reassured. Keep your gathering small, consistent. Outdoor activities are great if the weather allows. If you're indoors, if people are high risk, they can wear a mask. It shouldn't be odd. I've been saying for weeks, if you're playing board games indoors, you should wear a mask, because it is something we have to do for a while. But I think we can meet with a small, consistent group, keep our gathering small, and look to a safe, happy Christmas. And being vaccinated, boosted, and now being able to test before you go, I think is going to be really important.
It has been a really tough year for everyone. We're all dealing with it differently. Some of us can't turn it off. How are you doing?
I think on the one hand, it's been it's come in waves. So the work comes in waves, the concern and the anxiety comes in waves, and and the hardships that people face. There's economic impacts, there's emotional impacts, mental health impacts. People have had many episodes of when they couldn't visit with friends and family. So it's been tough on everyone. But at the end of the day, the fact that we have so many, we have strong family and community connections, all of us, including myself, that we can lean on. And it's also time over Christmas to think about your friends and family who may not have those connections, and to reach out. I think that's what people in Saskatchewan do really well. And that's, I think, something we should do this year as well.
This second year of the pandemic, I can't believe I'm saying second year, but the second year, it's been particularly trying for you. You had people protesting outside your home in January. You had that very emotional plea in October for people to get vaccinated during the 4th wave while we were facing that intense burden on the healthcare system. Have you ever just thought of walking away and quitting?
Everyone who works in public health, the team I work with, many people, epidemiologists, they've been getting up at 3 a.m. every day. Can you believe that? 3 a.m. to get the data ready for 8 a.m. And that's been for 2 years. So I think, a lot of us who work in public health and healthcare, as well as other professions, teaching, we have a passion, and this was the time to step forward. And many of us, in fact, most of us have stepped forward, not stepped back. But we also have to recognize it has taken a toll, and it has taken a toll on all of us. And we need to admit that, acknowledge that, lean on our friends and family, burnout, post-traumatic stress syndrome, especially for people in acute care who have seen, people, in many cases unvaccinated, and that was why I was very emotional. At that time, it was a pandemic of the unvaccinated, and for a vaccine-preventable disease still to take a toll this late in the pandemic was really heartbreaking. And so I think, and we need to have that insight in healthcare and in front other frontline services, and seek the support of family and friends. I think that's really important.
You did work closely with Scott Livingstone. I'm curious what went through your mind when you learned that he resigned.
Yeah, so I didn't have any discussion with him, obviously, and I haven't talked to him afterwards. Again, I know Scott right from the days when he was in the Ministry of Health and I was working as a regional medical health officer. He's been a great colleague and friend, and I wish him all the best. But again, it's been a long 2 years. Scott was leading the SHA, I think, for 4 or 5 years, right from the transition, and he did a great job. So again, I don't know the reasons, and I wish him well, but that is the reality, that very visible figures like Scott, but also many people, have either stuck with their plans. Some have delayed their plans for retirement. Some have brought them up earlier. It's a mix. But I don't know the reasons, and I wish him well. But again, he was a tremendous colleague throughout the pandemic and even before, as the SHA transitioned.
When you look back on the past year, is there something you wish as a province that we could just have as a do-over?
So it's very hard to say. Hindsight is always 2020, and we have been very careful to learn from what could we have done better. But the decision making is very complex, and I know many of us have said in the past that you know people have strong views, and that's great. People should have strong views. It's not just public health. The public are strongly embedded in what's happening around the pandemic, and that public engagement is critical and important. And at every step, some people say we have to move faster. Some people say, this is too much. Why are we going so early? It's always a balance, and we have to always, be humble, learn from what we could have done better. But we have to realize that we are not alone in this in Saskatchewan. We had a very challenging fourth wave. We have to get ready for what Omicron brings. But as we look around in Canada, in the US, in Europe, these are cyclical waves. They don't come at the same time in each country or province. But when they come, we have to deal with them. And that's what we have done, and that's what we will do.
I remember back when we had our first conversation, I think it was 6 months into the pandemic, and you told me about the nightmares that were keeping you up at night. Now I'm wondering, are you able to sleep, or what's keeping you up at night now?
Yeah, well, I think in March, April 2020, it was not knowing what was coming. And so that was the concern. Then after that, I think, throughout 2020, we knew how to manage it, and we did. I think 2021 early months were a sense of relief with how safe and effective the vaccines were. Like March, April, we had a wave in Regina, but long-term care residents are well protected, and now they've been boosted. So the sense of relief. In the fall, there was sadness and grief. Sadness and grief that even with the best tools available, people were, getting ill and dying. And so that was more sadness and grief. Now I think with Omicron, it's just the fact that, you know, this pandemic keeps throwing curveballs. So Omicron, we have to understand how more transmissible is it? How well do the vaccines work? How well will the boosters work? All these questions need to be answered for us in Saskatchewan. And then what can we do to minimize a rapid surge that's been seen in the UK, for example, and in some other Canadian provinces? What can we learn from them in very real time, on a day-to-day basis to better be prepared and manage the surge? So it is really more of not just me, I mean, all of my colleagues are kind of, getting ready. And again, I have to say that, we have the tools to manage it, and it will, and I hope the public has come together, because it has been very polarizing throughout the 2 years, and even as recently as the fall. But I think we can all come together, and ultimately we make our own decisions about travel, getting vaccinated. But as long as we can come together, at least support each other through these difficult times when things become difficult, I think that's the important thing. We may not always agree, but we really need to support each other as friends, family, communities, for us to, if we have to face another surge, which we likely will in January, February with Omicron, just we will get through. But how can we get through with the minimum of harm in terms of hospitalizations, with the minimum of impact in terms of people's lives and livelihoods, minimum impact for schools, for children going for in-person learning and other activities that are so important for them. I think that's what we want to aim for. And it's a balancing act, what further measures do you have to apply to achieve those results?
Looking to early 2022, I know you don't have a crystal ball or this would all be figured out, but what is your hope for early next year when it comes to healthcare and the pandemic in our province?
So I think it was great that, the service resumption started. All the non-COVID care was picking up steam. I think that is really great, because everything else is happening at the same time. People need non-COVID care. With Omicron, I think it's great we have the vaccines to boost and to complete vaccinations. I think we will see a surge of Omicron, like, anytime January, February, March, April. I think we should be settling down. I hope we'll have a great summer. In the fall, it's almost certain that we will have a booster dose for the fall, which may be a, bivalent vaccine with vaccines that have both the Omicron strains and Delta strains. That's my guess, and that's the end of 2022. 2023, who knows? Will we see one or two surges a year? Well, some of us who are, like older with risk factors need a booster. With all of us need a booster. How effective and available will antivirals be to also help with, preventing serious outcomes? All that is in the future. But I think, again, I have friends and family throughout the world, and I think we need to recognize how blessed and privileged we are. In spite of all these hardships, we are in Saskatchewan blessed and privileged. We need to support each other locally, but we also need to support the global community with access to vaccines and antivirals.
Well, Dr. Shahab, always a pleasure to chat with you. I want to thank you for your work and, of course, for your time today. I hope you get a break this holiday season.
Thank you very much. I'm looking forward to it. Thank you. Merry Christmas and have a happy, holiday season.